All right, so we're going to look at long bone anatomy, and to do that, I want to start with the humerus. The humerus that we're looking at here, not really important for right now. We'll go back and how we identify these later on. But for this, it is a good representative of a long bone, which is bones that are longer than they are wide, and they all form via endochondral ossification. This is going to give them some characteristic features and traits that we can identify on any long bone. So looking at a long bone, I am going to have three main regions in it. So on either end, I will have the epiphyses, and then a shaft or a diaphysis that connects the epiphyses. So when I look at this bone, this humerus, the epiphyse that is closer to the trunk is the proximal epiphyse. So that is the one on the left side of the screen. And then the epiphyse at the other end of the diaphysis is the distal epiphyse. The shoulder would articulate with this humerus at this rounded epiphyseal region of the bone. And you can actually see that line right here is epiphysis medially and then metaphysis laterally. And this is lateral going up out of the screen. So what we have here is a left humerus. Now, when we look at the inside of a long bone, we will see a little bit more detail in here, and that'll help to identify where you're at in the epiphysis, metaphysis, and diaphysis of a bone. As far as the outside, this is a good time to pause and ask yourself, do you know the names of bone features? Not the specific names of what we find, for example, on the humerus, but rather the generic names. Can you tell me what a trochanter or a tubercle or a tuberosity or a process, fossa, foramen, etc. are? If you can't, this is a good time to pause and go back and learn that vocabulary. Now, when we're looking at our long bone, if this were a fresh, living, recently, hopefully ethically acquired bone, then we would find that it has a layer of connective tissue on the outside called the periosteum. The periosteum is going to allow tendons and ligaments to anchor into the bone, as well as being attached to the bone with Sharpie's fibers, which are almost like little harpoons that go into the bone. And that allows those tendons and ligaments to pull, well, the tendons to pull and ligaments to brace joints or articulations. On the epiphyseal ends, so here and on the smoother portions that you can see here, we call these condyles. The bone looks a different texture because this would actually be covered in hyaline cartilage in a fresh bone, and that would smooth and help cushion the articulations and movements and impacts on those joints. Now, for the external anatomy of a bone, that's about all we really have to worry about. You will see the occasional hole, which is called a foramen, that allows a nutrient artery to enter. You usually find a couple of these on each epiphyses, and should find something on a diaphysis if we look hard enough, or near the diaphysis. And those allow vessels to go into bone and supply it with nutrients and then drain it, and for nerves to enter the bone. Okay, so if we then take our long bone, and I don't have a cut in half humerus, but I do have a bisected femur. And the humerus and femur are about the same, just some exaggerated epiphyseal structures, an exaggerated bony process here, just like on the humerus, and a diaphysis, just like we saw in the humerus. So this still works. So when we look at our femur, we're going to have on the proximal end, same arrows for directionality too, medial, lateral, proximal on the left, distal on the right. So when we look at these, I can see that there is spongy bone. It looks like a sponge. Shockingly, no one is really that clever with these names. That spongy bone, if you look at the actual lines in the trabeculae, they will spread across, and what they're following is force lines. So this is a bit more physics than my background allows me to speak authoritatively on, but it is transmitting force along the most efficient path, so that when the hip, which here's the acetabulum, which is what the socket is the femur fits into, is applying force to this because it's supporting our body, it's going to distribute that force along our spongy bone to areas of compact bone that can then withstand that. The same that we see over here. And you will get compressional force on the medial side and tensional force on the lateral side as this kind of wants to bend down. So those trabeculae actually tell you how force is displaced through a bone. Now we can also see in this, and I can tell, if I flip this over, I see my epiphyseal line. So my epiphysis is here. This is the metaphysis, and this is the diaphysis near my right thumb. So if I follow that line on the inside, on a younger bone, I would be able to see a layer of denser bone through here. Now this bone is from someone who was fairly older, and that's been remodeled and it's not as distinct as we would see in a younger bone. If we went to someone who was actually in adolescence, that would mean that they haven't reached their full adult height. Then you would find a layer of cartilage in here, the bone growth plate or the epiphyseal line. It becomes the plate once it ossifies as you've reached your full adult height. So as long as I have cartilage along here, I can lengthen this bone. Once I fuse that and I get just bone, now I can still grow bone, but I can only do it in thickness, or what we call appositional bone growth. Now, the spongy bone up here is allowing the force to be distributed over a wide area. So we don't need as thick of dense compact bone along here. However, when I get down to the diaphysis, there's no spongy bone distributing force anymore, and so I see the walls of the femur, or if I look at the humerus, same idea, are quite a bit thicker here to support that compressional and tensional force. So again, dense bone is really good at distributing, or I should say withstanding compression and tension or pulling, whereas trabecular or spongy bone is very good at distributing force from a smaller area to a larger area, so each piece of trabecular bone doesn't have to withstand the same amount of force. Now in the diaphysis we have this hollow space that is called the medullary cavity, and that is where we'll find yellow marrow. In the trabecular bone we will have red marrow. Red marrow is where hematopoiesis occurs, the formation of red and white blood cells, whereas that yellow marrow is important for caloric storage. When we age, when we get very old, it becomes more of a clear gelatinous marrow that is more to fill space and less to provide an energy reserve for us. Now, I believe that should do it for our long bone anatomy. Apologize if I've forgotten anything, but you should be able to fill in the gaps. And we'll move forward onto looking at the bones of the axial skeleton.